All right, let's dive in. Today we're tackling patient care skills. We're going deep into the California Community College's Chancellor's Office Nurse Assistant Model curriculum.
Sounds good.
Whether you're thinking about becoming a nurse assistant, maybe brushing up on your skills, or just curious about what goes on, behind the scenes in healthcare, get ready. We've got some fascinating stuff to uncover.
Absolutely.
Now, to help us break this down, we've got a real pro. Not only has our expert trained tons of nurse assistants, but also seen firsthand how these skills, these essential skills, really make a difference for patients.
Yeah, thanks for having me. I'm excited to, dig into this curriculum, share some real-world insights, like what it actually looks like out there.
Perfect. Okay, so this curriculum, it uses some pretty technical terms. How about we clear up a few of those for our listeners? Like, for instance, I had never heard of excoriation before.
Right, yeah, excoriation. And it sounds really complicated.
It does.
But it really just means like a scrape on the skin.
Oh.
Nurse assistants need to watch out for that, especially with, patients who have more delicate skin.
Right. So it's not just about knowing the fancy terms. It's about understanding what they actually mean for patients.
Exactly, yeah.
What about neuropathy?
Oh, neuropathy.
I saw that one in there.
Yeah, so that's when there's damage to the nerves.
Okay.
And it can cause numbness, tingling, or even pain.
Oh, wow.
Imagine like wearing a glove and your hand just feels tingly and numb all the time.
Yeah.
That's kind of what it can be like. And it's important for nurse assistants because, if a patient can't feel a burn or a cut,
Right.
it could get worse without anyone noticing.
Wow, I never thought about that.
Yeah.
It really makes you realize how important those observation skills are for a nurse assistant.
Definitely.
Speaking of which, the curriculum actually lays out like a typical day for a nurse assistant. It mentions AM care, PM care, even HS care, hour of sleep care.
Yeah.
So can you walk us through what a shift actually looks like?
Absolutely. So picture this, right? You're on a busy hospital floor. The day starts with AM care, which means helping patients get out of bed, assisting with bathing and dressing, and making sure they get their breakfast. It sounds pretty basic, but, for someone recovering from surgery or dealing with a chronic illness, these everyday things can be pretty tough.
Yeah. The document really stresses getting patients moving early in the day. It even uses the phrase motion is lotion.
Oh, yeah.
What's the thinking behind that?
Well, it's true. Even a little bit of movement can make a huge difference for a patient. It helps with circulation, prevents stiffness, and is even good for their mental well-being. But it's not just physical, right?
Yeah.
Imagine being stuck in bed for days.
Oh, yeah.
Helping a patient get up, even just to sit in a chair, can really boost their spirits.
Makes sense.
It gives them a sense of independence and control.
It's all about those little wins. And speaking of those little wins, I was really struck by how much the curriculum emphasizes maintaining a patient's dignity during things like personal care, especially bathing.
Oh, yeah. It's easy to forget that needing help with those personal things can be really tough for a patient.
Right.
So a good nurse assistant, they always remember that they're caring for a person.
Not just a task.
Not just a body.
Yeah.
It's the little things, using their preferred name, explaining what you're doing before you do it, making sure they feel covered. It's about respect and empathy.
Absolutely. So it's not just about getting them clean. It's about, that connection, making them feel comfortable and respected.
Exactly. And it might seem simple, but bathing a patient safely, there's actually a lot of skill involved.
Right.
Think about it. A wet bathroom floor can be really dangerous, especially for someone who's weak or unsteady. Nurse assistants are trained to think ahead, check water temperature, use those non-skid mats, make sure the call button is within reach.
Wow, it's like they have to be safety detectives.
Yeah, always on the lookout.
Creating that safe environment.
Exactly.
And on the topic of those seemingly simple tasks that actually require a lot of care, let's talk about oral hygiene.
Right.
Now, I thought brushing teeth was pretty basic. But this document made me realize there's so much more to it.
Yeah.
It even says that good oral care can make food taste better for patients.
Oh, it's true.
Who knew?
It makes sense if you think about it. When you're not feeling well, food can taste bland.
Right.
But good oral hygiene can bring those flavors back to life. And for some patients who maybe haven't been eating because they're sick, this can be a huge turning point.
That's amazing. These little things that can have such a big impact on their quality of life.
Absolutely.
I have to admit, though, the part about oral care for unconscious patients, That was a little intense.
Yeah, it takes special training. They have to
Yeah.
know specific techniques to make sure the patient doesn't choke or aspirate. Like, you wouldn't pour water into someone's mouth if they were lying flat on their back, right?
Definitely not.
So, for someone who's unconscious, it's about using a soft toothbrush, tilting their head, being super gentle
Wow.
and careful.
It really makes you realize the level of detail involved in all of this.
Yeah, it's pretty amazing.
And while we're on the topic of paying attention to those little things, let's talk about something that I think often gets overlooked, but is super important. Pressure sores.
Oh, yeah.
Pressure sores, they're a serious problem.
Yeah, and this curriculum really stresses the fact that they're usually preventable.
That's good.
But it takes vigilance, staying ahead of it.
Right. The document goes into detail about the different stages of pressure sores, from redness that doesn't go away to even like full thickness tissue loss.
Right.
I was surprised to learn that even sitting in the same position for too long can contribute to pressure sores.
Oh, yeah, absolutely. Imagine you've been sitting on your hand for a really long time. It starts to tingle and then gets numb. That's kind of what happens with pressure sores. The constant pressure cuts off blood flow, which means the skin isn't getting enough oxygen and nutrients.
The curriculum actually recommends doing this, like sitting on hand exercise to illustrate that.
Yeah.
I tried it myself,
Oh, yeah.
and it's pretty eye-opening.
It is. It really makes you realize how even just harmless pressure can have serious consequences. That's why nurse assistants are trained to reposition patients regularly, and they have to do it right.
Yeah.
So they don't drag or scrape the skin. They use pillows and cushions to protect those sensitive areas.
It's all about prevention.
Absolutely.
Stopping those sores before they even start.
Right.
It's like they're constantly playing this pressure point chess game,
Yeah,
strategically moving and supporting the patient to prevent those sores.
I like that.
And it shows how important critical thinking is for this job.
Yeah.
It's not just checking things off a list.
No.
It's about looking at each patient as an individual.
Exactly.
Yeah.
You have to assess, observe, and adjust your care based on their needs.
It's about going beyond the textbook, using your judgment to provide the best care possible. And speaking of going beyond the basics, the curriculum also covers nail and hair care.
Mm-hmm.
Now, it's easy to think of that stuff as just cosmetic.
Right.
But when you think about it,
Mm-hmm.
when you're not feeling well, having clean hair, trimmed nails, it can make you feel so much better,
Oh, yeah, absolutely.
more human, more like yourself,
It can really boost morale.
and help them feel a sense of dignity.
Definitely.
The document even says that just choosing the right clothing can have a positive impact on a patient's self-esteem.
Yeah, like imagine recovering from surgery.
Right.
All you have are those boring hospital gowns.
Yeah,
But then someone offers you a comfy sweater or a colorful shirt.
that would make a difference.
Huge difference.
It's about those little touches that make them feel cared for
Exactly.
and respected. And speaking of tasks that require sensitivity and attention to detail, let's talk about shaving.
Okay.
Shaving might seem pretty straightforward, but for a patient, it can be a really big deal. It can cause anxiety, embarrassment.
For sure.
A good nurse assistant understands that.
Yeah, it's a very personal and sensitive thing.
Absolutely. And the document really emphasizes how important it is to respect a patient's preferences
Mm-hmm.
about shaving.
Absolutely. Some people like to shave every day, some don't.
Right.
It's about asking, listening, and respecting their wishes.
It's about giving them back that control,
Exactly.
even when they might be feeling vulnerable. Now, this next topic, it might not be the most glamorous,
Yeah,
but it's a fundamental part of patient care, helping with elimination.
absolutely. It's a sensitive topic, but it's something that nurse assistants deal with every day. It takes a lot of empathy and understanding.
The document mentions that how often someone needs to urinate can vary a lot.
Yeah.
Some people go every few hours, while others can go, 8 to 12 hours.
Right. And a good nurse assistant learns to recognize those patterns for
Yeah.
each patient and helps them accordingly, whether that's helping them get to the bathroom, offering a bedpan, or assisting with catheter care.
Right.
It's all about making the patient feel as comfortable and dignified as possible.
And it's not just about the physical act.
Yeah.
The document also talks about watching for any changes in color or odor and reporting those to the nurse.
Oh, for sure.
Those little details can be really important.
Absolutely. Those are clues to the patient's overall health. You have to pay attention. Advocate for your patients.
Yeah, it's like being a detective,
Yeah, exactly.
looking for those subtle signs.
Mm-hmm.
And speaking of issues that can be tough for patients emotionally, the document also covers urinary incontinence.
Yeah, that can be really hard for people. It can affect their self-esteem, their social life, even their mental health.
Right.
So a good nurse assistant, they understand that.
Yeah.
They can provide practical help and also emotional support.
Reassurance.
Yeah,
It's about creating that safe environment
absolutely.
where they feel comfortable sharing their concerns.
Definitely. And speaking of procedures that need specialized care and sensitivity, let's talk about catheters.
Okay.
The document goes into a lot of detail about different types of catheters, why they're used, and how important proper care is to prevent infections. There's a lot to it.
It is. It's a common medical device,
Yeah.
but there are risks. Infection being one of the biggest.
Right.
That's why proper care is so important. Nurse assistants are trained to make sure the tubing isn't kinked or blocked, the bag is lower than the bladder, and the area around the catheter is clean.
So much attention to detail,
Yeah.
all to prevent those complications.
Exactly. And when it comes to helping patients regain control, the document talks about bowel and bladder training.
I thought that was really interesting.
Yeah.
Because it highlights how patients can actually regain their independence.
Oh, absolutely. But it takes patience, understanding, and a real team effort between the patient, the nurse assistant, and the whole medical team. Right, so the document outlines the goals and methods for that training. And it emphasizes being consistent and using positive reinforcement. It's really about empowering the patient
Totally.
to take control of their recovery.
Yeah, and a good nurse assistant can make all the difference.
Right. It's about celebrating those small wins, recognizing that even those little steps can lead to big improvements.
Yeah.
Now, this next topic needs a lot of sensitivity. Ostomies.
Yeah.
Ostomies, they can be life-saving procedures,
They can.
but they also represent a huge change for patients. It's a topic people don't often talk about.
Right.
So it's great that the curriculum addresses it.
Yeah, absolutely.
The document gives us this comprehensive overview of ostomies, what they are, why they're done, how to care for them. It's clear that nurse assistants play a huge role in helping patients adjust to life with an ostomy.
They really do. Imagine having to learn how to manage a new bodily function, dealing with the emotional and social stuff that comes with it, and figuring out all the practical challenges. It can be really overwhelming.
Yeah.
A compassionate and knowledgeable nurse assistant can be such a huge help, providing not just physical care, but also emotional support and guidance.
It's about helping them find their confidence again,
Totally.
helping them go through this new chapter in their lives with dignity.
Exactly. And speaking of those essential skills that often fall under the nurse assistant's responsibilities, we can't forget about measuring height and weight.
Right. That might seem pretty straightforward. But the document really stresses how important accuracy and consistency are when taking those measurements.
They are, because height and weight, those are key pieces of information. They help track a patient's progress, understand their nutrition.
And see if certain medications are working.
Exactly.
So the document lays out the steps for weighing and measuring height. It talks about using calibrated equipment, the right techniques, and of course, recording everything correct.
Yeah, all important stuff.
And if a patient can't stand, there are other ways to do it.
Right.
It's about adapting to each patient's individual needs, making sure the data is reliable.
Absolutely. It's all about precision and attention to detail.
Okay, let's shift gears to something that really highlights how important personalized care is: prosthetic devices.
Okay.
This part of the curriculum covers all sorts of devices: artificial limbs, hearing aids, contact lenses, eyeglasses, dentures. It's a fascinating look at how assistive technology is used and how nurse assistants help patients adapt to using those devices.
Yeah.
The document really emphasizes how important it is to understand the care and maintenance for each type of device.
Right. Each one is different. Like artificial limbs need regular cleaning and checks.
Okay.
And patients need to be taught how to put them on and take them off correctly.
Right.
Contact lenses have to be cleaned and stored properly.
To prevent infections.
Exactly. Hearing aids need to have their batteries checked and be cleaned regularly.
Make sure they're working right.
Exactly.
It's all those little things that make a big difference for a patient. And speaking of devices that can have a huge impact on someone's quality of life, let's zoom in on hearing aids.
All right.
The document has this really interesting overview of how hearing aids work, their parts, how to maintain them, how to care for them. It's amazing how much tech is packed into such a tiny thing.
It really is. And it's important to remember that even the best hearing aid won't completely fix someone's hearing. So patience, understanding, clear communication, those are key.
Definitely. The document explains how the microphone in a hearing aid takes sound waves and turns them into electrical signals.
Right.
Then those signals are amplified and sent through the ear mold to the eardrum.
It's pretty amazing how something so small can make such a big difference for someone.
It is. The document also explains, step by step, how to put in, take out, clean, and store hearing aids.
Yeah.
It emphasizes handling them carefully and avoiding moisture and extreme temperatures.
Right.
But it also talks about how to troubleshoot common problems like a whistling sound or when the sound cuts in and out, which could mean a problem with the battery, the placement,
Yeah.
or even a crack in the ear mold.
Absolutely.
It's all about making sure the patient's hearing aids are working properly.
Yeah. Being proactive, making sure they're getting the most out of him.
That's just one example of how nurse assistants contribute to the overall well-being of their patients.
Absolutely.
It's amazing all the different skills a nurse assistant has to have.
Right.
It's like they're the Swiss Army knife of healthcare.
Yeah. I like that. A mix of, technical know-how, compassion, and those sharp observation skills.
Yeah. And we've seen how even the simplest tasks can really affect a patient's well-being. It's not just about checking boxes.
No.
It's about making a real difference in people's lives.
Absolutely. And it's interesting how all these, seemingly small tasks,
Right.
they all connect to create this bigger picture of care.
Right. We've talked about hygiene, mobility, safety, the emotional side of things. And they all work together to create an environment where patients can heal,
Yeah.
where they feel supported and respected.
Yeah. It's about treating the whole person,
Right.
not just their illness or injury.
So much of what we've discussed today comes back to that human connection.
Yeah, those little acts of kindness, those moments when you really connect, that can be so powerful for a patient who's feeling vulnerable.
Right. It's about making them feel seen,
Yeah.
heard, not just like another patient in a busy hospital.
Exactly. And that's what makes this job so special, is everyday acts of compassion. They can really have a ripple effect.
Yeah. It's about going beyond your job title,
Right.
really connecting with another human being.
Absolutely. And those moments, they're rewarding for both the patient and the caregiver. It's a reminder that caregiving, it goes both ways.
Yeah.
You give, but you also receive.
You receive that sense of purpose, that feeling of connection, the satisfaction of knowing that you made a difference.
Absolutely. And, that brings us to something we talked about earlier, the growing need for healthcare workers.
Right.
With people living longer and more chronic conditions,
Right.
the need for skilled and compassionate caregivers is only going to get bigger.
Yeah. That's a trend we can't ignore. It makes the role of nurse assistants even more important for the future of healthcare.
Absolutely. And while the demand is growing, we also have to acknowledge the challenges.
Right. It's physically demanding,
Yeah.
emotionally draining, sometimes undervalued.
Yeah. But despite all of that, nurse assistants keep showing up every day. They provide this essential care with such dedication and compassion. They really are the unsung heroes of the healthcare system.
I think it's time we recognize these everyday heroes.
Yeah.
Give them the support they deserve.
Couldn't agree more. And looking ahead, I'm curious to see how technology is going to change things.
Oh, that's a great point. What kind of innovations do you see on the horizon?
Well, with telehealth and remote monitoring becoming more common, I think we're going to see more care happening outside the traditional hospital setting.
So like virtual checkups
Yeah,
to
exactly.
make sure people are taking their meds.
Yeah,
Or to track their symptoms.
exactly. Imagine a nurse assistant being able to check in with a patient who just got home from the hospital,
Right.
answer their questions, address concerns before they turn into bigger problems.
That would be fantastic. Not only would it give people better access to care, especially in those areas where healthcare is harder to get, but it would also empower patients to be more involved in their own health.
Absolutely. And with AI, artificial intelligence advancing so quickly,
Right.
I can see those AI assistants handling some of the more routine tasks,
Okay.
which would free up nurse assistants
Yeah.
to focus on the human side of things.
The emotional support.
Yeah.
The compassion.
The things machines can't do.
Right. So it's not about replacing human caregivers with robots. It's about using tech to make their jobs easier so they can give even more personalized and compassionate care.
That's the key. Technology should help caregivers, not replace them.
It's about finding that balance
Yeah.
where tech and human connection come together to create a healthcare system that's truly focused on the patient.
Exactly. And I think the future of healthcare belongs to those who can combine those two things seamlessly.
So whether you're a healthcare professional, a student, or just someone who's interested in the future of caregiving, we hope this deep dive has given you a new perspective on the role of nurse assistants.
Absolutely.
And as we look to the future, I think it's important to remember that at its heart, patient care is about human connection.
It's about seeing the person, not just the illness,
Right.
understanding their needs, and providing care that's both skillful and compassionate.
That's a mission worth fighting for,
Definitely.
no matter what challenges come our way. Now, before we wrap up, I want to leave you with something to think about. Given how our population is aging and the increasing demand for healthcare workers, what innovations in patient care technology do you think we'll see in the future? What advancements would you like to see that would help both patients and caregivers?
Yeah, great question.
Share your ideas and predictions with us on social media. Use our episode hashtag. It really gets you thinking about what's possible, right?
It does.
Who knows? Maybe some amazing new invention is just around the corner.
Absolutely. And it's good to remember that the best innovations, they usually come from really understanding what people need.
Right. Tech should be there to help us.
Yeah.
Not the other way around. And when it comes to patient care, that means focusing on things that help both patients and caregivers.
Absolutely.
To create a system that's more compassionate and effective.
Yeah. Who knows? Maybe one of our listeners is going to invent the next big thing in patient care.
That would be amazing.
Yeah.
But even without all those futuristic gadgets, I think, we've learned that there's something really powerful in just caring for someone.
Absolutely.
It's those small acts of kindness. Those genuine moments of connection, they can make such a difference for a patient.
They can. Whether it's a smile,
Right.
a gentle touch, or just listening.
Those seemingly small things
Yeah.
can have a huge impact on how someone feels.
They really can. It's a reminder that, we can all make a difference in other people's lives.
Yeah.
Just by being there for them, showing compassion and being kind.
Well said. So we want to thank you all for joining us on this deep dive into the world of patient care skills.
Thanks for listening.
We hope you've learned some new things and maybe even gained a new appreciation for those unsung heroes of healthcare, the nurse assistants, who are out there every day providing compassionate care.
Don't forget to share your thoughts on, the future of patient care tech. Use our episode hashtag.
We want to hear from you.
Yeah.
Until next time, keep diving deep and keep exploring.